Welcome to Live at Kigali, directly from Kigali, the capital of Rwanda. My name is Dr. Haroun Ouanes. I'm a pharmacist. I'm a doctor in pharmacy with MBA from Sorbonne University. And I'm very pleased here to welcome our guests. It's a 100% doctors session about digital health transformation, the balances. I'm very happy to welcome today Dr. Jacqueline Kitulu from Kenya. She's a doctor, practitioner, and she's the chairperson of the board of Rocket Health. And she's also very well known in Kenya and Uganda. Also, I'm very pleased to welcome Dr. Ricardo Baptiste Leite, who's the CEO of the International Digital Health and Artificial Intelligence Research in Geneva. He's also next parliamentary in Portugal, and he's from the Nova University. Welcome to Live at Kigali. We'll start with our guests about our topic. So, digital health is something very important, especially that we faced after the COVID-19 pandemic. Mobile applications, mobile web applications, all of hardware and software solutions were in front of us. They helped millions of people. Now there is some questions about ethics in digital health, about the algorithms, and about artificial intelligence and its impact on this field. I'm very happy to begin with Dr. Ricardo about the context. What is the context for you about the digital health transformation now, the challenges, the new politics?
Oh, thank you so much, and it's a great pleasure to be with both of you here in Kigali. And the truth is, we are at the threshold of a new age with the rise of artificial intelligence becoming accessible to the general population and playing this transformative role in every aspect of our lives, including healthcare, which is my main focus, and of I-DAIR as an organization, as a neutral platform based in Geneva, trying to support research and access to digital health and AI solutions for better health and well-being. That being said, we need to acknowledge that the pandemic has accelerated many of these trends. We have seen some positive outcomes out of it. However, there is still an important part of the world that doesn't even have access to basic internet. 30% of the world doesn't have access. When we break down those numbers to sub-Saharan Africa, where we are today, we see that it is even more shocking. About half of the population potentially has never accessed the internet. And when we think about instruments that are used for connectiveness, particularly phones or smartphones, we see that about 20% of the population has no phone. And of the 82% that do have a phone, we know that half of them have what we call basic phones and half have smartphones. And then when you talk about internet access, we see that 13% of people with smartphones and 89% of people with basic phones say they never access the internet. So that alone should show us that we are looking at a divide that is greater in rural areas, a divide that is greater among women. And so we see multiple layers of barriers that exist. And from a health perspective, the further away someone is from a health clinic or hospital, the greater the probability they don't have access to a phone either. So this goes to show that you have multiple layers of barriers that can actually lead to a widening of the gap in terms of access to technologies and to the benefits that these technologies can bring. We talk about mobile access to health, for example, as a way to overcome these barriers. But we see that women, rural areas further away from hospital, are actually the ones that will benefit the least. And so we need to embrace these challenges so that we can maximize the impact, the positive impact, because there are opportunities for us, for regions of the world that have been constantly left behind, to leapfrog. But for this, we need a clear policy, clear strategy, But right now we are seeing that the richer parts of the world are benefiting and the poorer parts are left even more behind. And it's urgent that we turn around the table.
Thank you so much, Dr. Ricardo. It's up to you, Dr. Jacqueline. Dr. Ricardo talked a lot about accessibility for sub-Saharan countries, especially the low-income countries. How do you see accessibility for population, the grand population, also the health providers like doctors, labs, and clinics? And do you see it like a challenge, the interoperability systems, and if it can really help the accessibility of digital health to the population?
All right, thank you very much. And indeed, very delighted to be here at Kigali Live and be part of this very useful conversation. So in terms of access and increasing access in the lower income countries, and indeed I am from Kenya, so one of the lower income countries, and I will give examples, some of them based around that. There are several roles that can be taken in terms of increasing access. And we can start with what governments do. So the governments themselves have to look at ensuring that there is increased connectivity in rural and underserved areas, and I think you already did mention that, so that way you increase the internet penetration. There's the role also of governments in, perhaps I would say we need to utilize what governments have already done. So the already existing DPIs, such as digital registration of persons, we could add on services onto that, into such systems. And this, I am from the health sector, and indeed adding health components to what already exists and which government is providing can enable more people to access healthcare through digital platforms, supporting increased mobile phone ownership. Indeed, you've given statistics, and I think in Kenya we have very high, phone penetration. But then what we do with that? Then have access mobile health apps, ways that people can access health through those telephones. Is it USSD? Is it internet? Using those, what is available to seek those services. And indeed, on one of the companies that I do chair the board of Rocket Health, our members can reach us on a USSD platform, so a simple phone can reach, and also one with internet connectivity can reach the same. We are looking at community engagement. In terms of access, sometimes we just think about the government, we think about who the other players, but what about the community? In terms of involving them in designing, in terms of implementation, evaluating those digital health initiatives, awareness campaigns, getting them to be part and parcel of widening that access based on their needs. Public-private partnerships, very crucial, I think, because there's a big part that the private sector are doing, there's what the public sector are doing, and a lot more can be enhanced without reinventing the wheel. So the public sector can do what they're doing, the private sector the other, and when they come together, offer a service that increases access to that digital health. You asked something about the interoperability and whether it is necessary to make the health infrastructure accessible. And I think, honestly, it should actually be made mandatory. There is no point of having silos of information. In Kenya, actually, they are working on a single EMR for public hospitals called Open EMR Project. And it's been designed in such a way that other digital solutions in those facilities will be able to connect to it. And a similar approach has also been done for reporting health facilities to the DHIS too, so that all the information gets into that platform. So when you ask about interoperability, it should actually be made mandatory if we are going to benefit in terms of access to these digital platforms.
Thank you so much, Dr. Jacqueline. We had a chat like 5 minutes ago, and you told me you get your MBA in order to talk the language of policymakers. So I'm going to Mr. Ricardo, the ex-member of parliament. How do you see we can talk? I think you know how to talk with politicians. You are You are one of them. And what is the public policies that we need to advocate for better health care, access to communities, for better regulations? Now the challenges of ethics, the challenges of algorithms due to artificial intelligence. How can we make good public policies in terms of regulations for the government or the parliaments in the world, but especially in Europe or Africa, as you like?
Well, I do. I have been a 4-term member of parliament in Portugal, and having worked also at the local government, but I also run Unite, the Parliamentarians Network for Global Health, in 97 countries around the world. And what we have seen consistently, high or low in middle income countries, is that there is a fear factor behind the political decisions and a lot of lack of knowledge. And this is leading to bad policy or no policy. And so we need to make sure that we talk about digital literacy of the people. We also need digital literacy of our leaders to make sure that they make the right decisions. And that's what organizations like Unite and so many others have to play a role in doing. But we have to go further than that. And honestly, when we talk about digital health and artificial intelligence in particular, we need to acknowledge that we are also in a new age of health technology assessment. Until now, you know, until thalidomide hit the market, which was a medicine for anti-vomiting, a medicine that was used among pregnant women, that led to 10,000 birth defects. And that began an age in the 1950s of regulation of medicines. And that created a process in which we believed that based on clinical trials, looking at 5,000 or 10,000 patients' results, we could determine if a certain technology, drug, medtech, was safe and if it was efficacious towards achieving its goals in terms of its health outcomes. And as soon as the regulators say it's good to go, it would enter market, and blindly, for decades, we would believe those clinical trials from back then. With AI, if you try to regulate it in the same manner, if you try to assess the algorithm today, the next usage by the next patient, the algorithm is going to change. So that methodology has failed right from the beginning. And so I believe that we are entering an age of hybrid policymaking or hybrid regulation of technology and healthcare, in which we will have to use machines to supervise machines to identify ethical, responsible AI algorithms and have a red flag system that informs humans that a change in the algorithm has put the humans at risk, to allow human intervention in real time. This hybrid approach, I believe, is one I-DAIR is already looking at and developing solutions for, and can generate trust among policymakers and citizens to show that we are addressing this issue very seriously and never forgetting what we learned in medical school, which is first do no harm. And we should apply this scientifically and rigorously also when applying AI.
Okay, thank you so much for the great answer. Let me go back to Dr. Jacqueline to ask more about the transfer of technology in the digital health sector. There is a lot of software solutions, hardware solutions, Internet of Things. There is a lot of success stories, I believe, in Kenya, since it is now the hub of startups, of Anglophone startups in Africa. How do you see, or the success keys in order to have a successful transfer of technology in the digital health?
So thank you again for that. Indeed, there's a lot on the on the digital front in Kenya. And I think for success, there's a number of things that we do need. And we know cost is always a big issue wherever we are, and we are talking lower middle income countries. So one of the things is supporting the use of open source digital tools. I think it is fundamental and critical because every time you have to pay for a new platform, then you reduce the access instantly, so we're even unable to transfer that. So open source digital tools which need to be supported by governments. Then there's that issue of protecting data protection. You see, these are the things which limit data transfer because there's the worries and there's the fears and indeed those we do come from the medical background, and many of the people who are the ones who will stand against us, the new digital professionals, will be the health professionals, because from an ethical point of view, there's the issues around confidentiality of your patient, the privacy of your patient. So when you don't have a structure or data protection laws and regulations, then already you have a challenge about trusting the system and protecting the details. So happy to say that we have the Data Protection Act of 2019 for Kenya, and it's really now being implemented and getting everyone who uses data to be part of understanding what it means for privacy and confidentiality. The issue of financing, and this is the part which comes in about private firms and public coming together, PPPs. This is where the venture capitalists can come in, the private equity firms can jump in. But in that process of data transfer, encouraging research and innovation and digital technology tools. Again, these are areas. The research has to be a constant. We always have to be looking what is new, what is it that we need to be changing, what differences do we need to make to reach out to more. And even amongst digital technology providers themselves, encouraging partnerships, because there are very many people reinventing and doing the same things and doesn't enable technology transfer. So if they came together, they would move much faster. I don't know I think you mentioned about, for us, leapfrogging in this. I think that will be part of it, that we have the digital technology providers sharing the data and going back to even that issue of interoperability of systems. It comes in there and assists with the transfer. And indeed, as you were talking, it's one of the things we're talking about AI, and saying interoperability will definitely enable AI to literally learn, and from the analytics be able to improve public health interventions and learning and improving individualized patient care. So there's very little AI will learn if there are segmented approaches, and all these are part of what we are doing in terms of enhancing technology transfer.
Yeah, thank you so much for all of these examples. We have only 1 minute to finish, maybe with good perspectives about research and development for you, Dr. Ricardo, and about perspective on the ground for solutions and startups for you, Dr. Jacqueline. We will start with you, Dr. Ricardo, in 20 seconds, and then 20 seconds, Dr. Jacqueline.
Well, in 20 seconds, I'll just say I-DAIR is working on a distributed federative research infrastructure in which we are distributing AI computers. We call them AI Lab in a Box, to several low and middle income countries, and providing a codex that allows researchers to develop native AI solutions based on the ground, keeping the data for themselves, providing solutions for their people, and being able to do that in a federative way so we can learn from each other. I believe that is the future, not only of AI, but of digital health, and we're proud to be part of that process.
Thank you so much.
So in terms of success stories and what are we doing, Rocket Health has an end-to-end solution, and this is how we bringing access to healthcare. So end-to-end in terms of consultation being available, the lab services and pharmaceutical services. So most of the providers in the past have done one or the other, but that does not make it any more convenient for a patient. So creating a solution that reaches all these and at a cost that's affordable and accessible. So even those who are unable to travel, for example, to a facility and sit and wait and to be served, can have that done from the comfort of their home. They can have their vaccinations done from the comfort of their home. They can have their wellness checks, all the things that basically increase our access to quality healthcare. Yeah.
Thank you so much. That was the Live at Kigali 100% session with medical doctors. About the digital health revolution, the Balancing Act. This is Haroun saying goodbye. Thank you so much.